Greetings, everyone. Happy Black History Month. Happy Health Heart Month. Welcome to the new WCEG network on the WCEG Talk Radio. We are the worldwide community empowerment group where we speak live into the community. I'm Dr. Babs, your show host for this February segment of the Holistic Perspective, and I have a wonderful co-host with me, Mr. Mark Maloney. I will be introducing him shortly, but you got to believe it. We are in for a great time. We have an amazing hour of empowerment, encouragement, as well as education as we discuss how well is your heart. This is the Heart Awareness Month, so we are going to dive into everything that has to do with the health. Thank you for tuning in. We are live on all your social media handles. You can check us out on YouTube, Instagram, Facebook, also the WCEG Talk Radio Network. So please tag a friend, share with your friends and neighbors. Sharing is caring. We impact a lot of great nuggets and you don't want to miss anything at all. But before we get started, I have two quick disclaimers. The first one is the information shared on this talk radio is not intended as medical advice. So please maintain your relationship with your provider. This is all just to support your holistic wellness journey. And two, the views and opinions expressed by the host and guest do not necessarily reflect views and opinion of the WCEG network and management. So let's get started now. I love to start with an inspirational quote about our holistic health. And this one is an unknown author. But what it says is that with a healthy heart, the beat goes on. So let's let that sink in, right? With a healthy heart, the beat goes on. So this quote speaks about how relevant the heart is to our overall well-being. So our goals today, my guest and I, we're going to talk about how the heart plays a significant role in our wellness. We'll talk about the risk factors. How do we measure our blood pressure? We're going to talk about how to prevent and treat heart disease. We're going to provide several resources that you can avail yourself of, and we'll also talk about some of the questions that we've had clients, patients ask from our experience. So we welcome your engagement, we welcome your questions, so please send them in and we'll be happy to respond. But give me a few minutes just to introduce my guest. Mr. Maloney serves as a public health program manager on the National Hypertension Control Initiative, funded by the Health Resources and Services Administration and the Office of Minority Health with the American Heart Association National Center. Mr. Maloney develops and implements plans to build health equity based on the association health impact goals for cardiovascular health, including strategies for eliminating health disparities involving cultural competencies initiative. He is a subject matter on cardiovascular health with tons of experience. I've worked with him personally at Grady East Point, and he has a heart to serve and help his community. So I am so pleased that you're joining me today as a co-host. I'd like to welcome you now to share some of the work that you've done in the hypertension field. Take it away.
Thank you, Dr. Babs. Thank you for having me today. Yes, as Dr. Babs shared with you, I'm working on the National Hypertension Control Initiative on a national level with the American Heart Association, funded by HRSA and OMH. So the work that we're doing, we're working with over 350 federally qualified health centers throughout the United States on helping the health centers get a better control of their uncontrolled patient population. And with that, in addition to that work, as Dr. Babs had shared with you, we worked collaboratively on a project on hypertension and controlling the uncontrolled patients in the health center at Grady East Point, and we were very successful in changing lives and behavior and empowering the patients to take control of their blood pressure by using SNBP, self-monitoring blood pressure. Some other initiatives that I'm very proud of is a community where I worked with barbershops. I wanted to focus on African American men, Black men at the barbershops, and so developed this program to train the trainer, to empower these barbers to add to the conversation of sports, family, religion, politics, add blood pressure to that conversation. Do you know your numbers? And so we trained a set of barbers, well, several barbers in the metro Atlanta area here to start screening for blood pressure and distributing health educational material and directing or linking their clients to healthcare providers for further check up and follow up on their blood pressure. So, and then, working the Hispanic population as well, centered around healthy eating, empowering them to, in terms of cooking demonstrations, the importance of the lifestyle change in your behavior with preparing your food, meal prep. And so those are just a few of some of the projects that I've worked on. And the list can go on and on and on, but we don't have that much time. So I'm going to pass it back to you, Dr. Babs. Thank you.
Thank you so much for sharing the work that you've been doing within the community. As you mentioned at Grady East Point, we're so pleased to collaborate with you, where we had such significant outcomes with blood pressure control. And it was all about identifying what those risk factors are and knowing how to measure, right? So knowing your numbers. If you don't know, you can't do anything about it. And we know that heart disease is the #1 killer in the US and worldwide. Currently, it's stated that kills about 17.9 million people every year, and it's expected by 2030 to go past 23.6 million. And 80% actually is attributed from heart attacks and strokes. So this is so important. It's paramount that we identify what those risk factors are. We have to know our numbers. We're no longer in the season where we say what we don't know doesn't hurt us, it doesn't harm us. We have to take charge. So before we dive into how to measure our blood pressure, we have a few slides here to share. And so let's talk about what are some of those risk factors, because I'm sure you're asking the question, how will I know if I have heart disease? Or what are the examples of heart disease? I already mentioned hypertension. We talked about diabetes. Diabetes is one. If your sugar is uncontrolled, if there's high cholesterol, all those things can affect the heart. But then just because there's a family history, which we all should know what our family history is, it does not say for a fact that you're going down that line. So the way I always liken it, that your genetics might load the gun, but your lifestyle will pull the trigger. So that's what we need to pay attention to, the modifiable risk factors. So the ones that we can modify are age, our gender, where we were born, the family genes. Like, for instance, I have a family history of hypertension, diabetes. So being aware of that. Now, what are the ones that we can modify? It's definitely if we smoke, if we're eating poor nutrition, lack of exercise, all those things can actually be modified in terms of changes that we can actually make to prevent our beautiful red pump from getting overwhelmed. And the way we look at it and the way I describe it helps me also remember is that it's one of those organs that receives, right? So it gets blood, oxygenated blood from the lungs to spread with nutrients and oxygen. And once it gets that oxygen, it spreads it to the rest of the body. So it opens up, gets the blood, gets it oxygenated, and sends it out its way. So imagine some of the symptoms that patients can complain of is, I'm just tired. So if the heart is not working the way it needs to because there's a blockage somewhere, then you're tired. You just don't have the energy. Or, some people might have pain because there's an obstruction. So if you have a lumen and the blood is not flowing adequately, right, because of cholesterol plaques, it just becomes more narrow. Or maybe the pressure is just so high, then it becomes damaged vessels and blood cannot flow adequately and resulting in shortage of blood supply and stroke if it gets involved in the brain, or heart attack if it gets involved in the heart region. So those are some of the risk factors and some of the diseases. I'm going to pass it on now to Mr. Mooney so that he can tell us how we can find out if blood pressure is an issue, because we have numbers and we have to make sure that those numbers are properly taken. If not, you might just get a false number, and we want to make sure we have adequate numbers.
Right. So what I would like to do, thank you, Dr. Bass, for passing it on to me. So one of the things that I do, as you know, in my work, not only with health centers, but in the community at large, whether it be faith-based, as I mentioned earlier, barbershops or salons or adult living facilities or community centers, rec centers, et cetera, is these are, I focus on empowering patients to take control of their blood pressure. And I do that through self-measured blood pressure. And so what you see on the screen here are like 5 questions that are most commonly asked from in the community, again, with the patients in the health centers, again, in the faith-based organization. It says, what is self-monitoring blood pressure? And it's self-monitoring blood pressure is when you measure your blood pressure outside of the doctor's office or other healthcare settings. That's what it is, taking your blood pressure at home. And why do I need to measure my blood pressure? My blood pressure was already measured at my doctor's office. And I'm gonna share something. I'm gonna let Dr. Babs also chime in on this. But SMBP is what we refer to as self-measured blood pressure, allows you to measure at different times throughout the day and over a long period of time, helping your doctor get more of a complete picture of your blood pressure. Would you agree with that, Dr. Babs? Anything you would like to add on that part?
Yeah, absolutely, because it does fluctuate. It fluctuates a lot. I've had patients come, my blood pressure is fine at home. It's only when I come to the doctor that it's elevated. And some people just don't even check it. And the only reading that we have is when you're in the doctor's office. So as we know, depending on the night that you've had or the day, it can be affected by our stress levels, cortisol. So it is definitely important that we don't just rely on when you go to the doctor, maybe it's once a year or 3 times a year. It's good to have a sense of the average. And that's the only way that you can do it if you empowered to measure your blood pressure.
Absolutely. Absolutely. Thank you for that. And a third question that I get a lot is, how does SMBP help me with my health? By using SMBP, self-measured blood pressure at home, you and your care team can come up with a treatment plan, as Dr. Babs mentioned, to better control your blood pressure, which can prevent more serious health problems. The health problems, as Dr. Babs had mentioned, the stroke, a kidney, an impact on your kidney and other organs that you have. That's just from examples there. So what another question, it says, what do the numbers mean when I take my blood pressure readings? And Dr. Babs, I'm going to pass that over to you.
Yes, and I'm glad that you brought this question up, because a lot of us see a top number and a bottom number, right? And you're wondering, what does that mean? So we have 2 numbers. The top number is systolic, and that just means when the heart is contracting, right? Remember I said the heart is that beautiful red pump, right? And so just to simplify it, it gets blood from the lungs, which is oxygenated. It carries it all over, and then it supplies it with the oxygen. So you can imagine it's pumping. It pumps to push out and it relaxes to receive. So the top number is your systolic, and it's just as important as the bottom number, which is diastolic. And there is a range. So contracting on top, relaxing on the bottom. some people say, well, but which value is more important? I mean, if my top number is fine, do I have to bother about the bottom? Yes, you do, because the bottom is where the heart relaxes to receive the blood that needs to be oxygenated. And if it doesn't relax, guess what happens? It's all stiff and tight. Then you're having a backlog, and that's where people have all sorts of congestion. They have overload. So you need to open and receive, so that's why the top and the bottom matter, and their ranges, and we'll talk to you about what those range. Now, just to throw it out there, you probably heard 120/80, less than 120/80. That is ideal. That is normal.
Right. Thank you for sharing that. And because that's so important, because working with a lot of patients in the health centers, again, and also in the community, they really don't understand those numbers or what they mean and how it impacts their overall blood pressure. And thank you for sharing that. And the last question is what are some important things to know before I start measuring my own blood pressure? That's very important, and a very important question, and good question. Use an SMBP device and a blood pressure cuff that is recommended by your doctor or care team. So if you go to the doctor and they give you a monitor or cuff to take home, use it. Like you take your prescription, your prescribed medication, use that SMBP cuff. If you purchase your own device, ask your care team to check the accuracy of that device. Understand the correct way of taking blood pressure readings, which I will share with you later on in a couple of my slides here. Know when and how to share your blood pressure readings with your doctor. I also have a tracker that I highly recommend for you to download free to track your blood pressure. Make sure you use instructions from your care team on what to do if your blood pressure is out of its expected range. Those are some key points to remember. And so let me go to one of my next slides here. And this is really to kind of add to what Dr. Babs had shared with you all, with everyone. It says understanding what hypertension does to your body, the vessel, the heart, the lungs, the kidney here. As you can see the visual here of a boxer boxing your kid.
So we need to advance the slide. It's not advancing on the end.
Okay, I'm sorry.
Okay, perfect.
Sorry.
Now it's moved.
All right, sorry, that's my fault. Oh, I'm sorry. So understanding what hypertension does to your body. As you can see in this image here, a boxer boxing, beating up on your kidney. That's what blood pressure does, as she mentioned. And you see down the other visual here, the house and the water hose, the vessel, that water hose is a vessel. Now imagine if you use that home water hose and attach it to the fire hydrant on the street. And what the pressure from that fire hydrant on this home water hose, what do you think it will do? It will expand, just like the pressure in your blood pressure. So we kind of share these visuals to give people an idea. And here's some best practices as it relates to lifestyle changes. You always hear what you're not supposed to do, not supposed to eat, and et cetera. It wants you to quit cold turkey. We know that's not reality. In some of our work, we do starting with a 30% change in your lifestyle. If you buy your cigarettes, take out 30% for the first week and increase that percentage until you eventually change that behavior. Exercise and weight, and control your weight. Diet is very important. And here's another example. The blood pressure readings the same as weighing when you're dieting. For an example, know your numbers. Going back to when I was stressing, know your numbers. When you're on a diet, you get on that scale, where your baseline, where you started, and where you want to go. And you can also contribute to what you ate that particular day. If that scale, if your numbers don't go down on the weight, you can say, oh, it was that bag of chips, or it was that McDonald's hamburger, right? That perhaps that impacted me not losing weight this week. So think of your blood pressure the same way. Know your baseline. What is your baseline? So, and then as you continue to check your blood pressure, you are empowered to know what did you do to contribute to elevate your blood pressure, whether it's your diet or exercise. Here is the chart of what Dr. Babs had shared with you earlier in terms of what is a normal blood pressure, elevated blood pressure, hypertension stage 1, hypertension stage 2. So normal blood pressure is 120 over 80 or less. Elevated is in between 120 and 129. Less than 80. Hypertension stage 1 is between 130 through 139, and your diastolic 80 through 89. And it goes on in terms of the different stages. The crisis, higher than 180 and higher than 120, 80 over 120, you run to the hospital, to the emergency room.
Yes, and if there's a reason why they say hypertension is a silent killer, because even in the hypertensive crisis level, for some, because the body is resilient, the heart it works so hard just to keep us going, keep us alive. So sometimes it's just silence. So don't ever, please, take it for granted that everything is okay. If you haven't checked it, if you know there's a family history, and if you know that you're not eating the best, and if you know you're stressed, please keep an eye on it. That's if you've never been diagnosed with high blood pressure. But then if you have been and you're on medication, I'm a strong believer that it's reversible, preventable, treatable, and reversible. I'm a living witness to that. I had hypertensive crisis, but in my case, I had the worst headache ever. It was going on for 4 days, pounding, but I had just had a baby less than a week, and I thought I was just sleep deprived. But I'm so grateful that I finally decided on the 4th day that this is not going anywhere. I need to check my blood pressure. Never had blood pressure issues. And lo and behold, it was 220 over 120. And like Mr. Mooney already said, run to the emergency room. And that was what I did. I dropped my baby, I dropped my toddler, I dropped even my husband and ran to the emergency room. And they said if I had only waited just 30 more minutes, I would have had a stroke. So the message here is please, 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 even if you don't have symptoms, I had symptoms, so that alerted me. But if you don't have anything, but you know what you're doing, you know yourself best. I was overly stressed then, and that really was what it was. I was stressed, and stress, I'm a testimony to how stress can actually raise your blood pressure. You saw the diagram where the hose, once you put pressure and you hit that vessel over and over and over and over, it damages, that. And you see that punching bag? Cortisol will do that and constrict your vessels and cause your blood pressure to go up. And gradually it will just boom, and it will just go up. So back to the number chart. Make sure that if it is high, don't sit on it, even if you're not having symptoms. Don't sit on it. Call your healthcare provider, have that conversation where they review and know what's the cost of it. I always emphasize getting to the root cause, the cost of it versus the symptoms. Symptoms are good, but you don't want to just, mop the ground because the roof is leaking, right? You also want to patch what's going on in the roof. So please pay attention to these numbers. Keep them, screenshot them, just make sure you know what your numbers need to be, because over a long period of time, if your heart stays at this high number, then it's going to say, you know what, I can't take this no more, I can't keep up. Then it gets larger, and when it gets larger to expand to accommodate the pressure, then that's where we have congestive heart failure. That's where we have all the other complications that arise from just the heart not functioning at its best.
Correct. That's great. Yeah. And so, as I promised here, in terms of when you are measuring your blood pressure at home, you must do it properly in order to get an accurate reading. This is a diagram here, 7 steps, simple tips that you see here on the screen here. Make sure you use the correct cuff size. Make sure you do it on a bare arm. Make sure you use support your arm at the heart level. Keep your legs uncrossed, your back supported, and feet flat on the ground. Empty your bladder and don't have any conversations, because those last two things I mentioned could trigger and elevate your blood pressure. Is that correct, Dr.
Oh
Bass?
yeah, absolutely. I laugh because that happens a lot. Well, and I'm so glad that this is out. And thanks for sharing this slide, because I must be honest with you, until when this became an initiative, we were just measuring blood pressures and we had so many abnormal blood pressures, but it was because we were not measuring it adequately. And so we need to empower yourself. Know this. If you go to your health provider and they're not measuring it the proper way, tell them. I had a patient that told me a few weeks ago, my blood pressure is high, the CMA didn't do it properly. And I said, what do you mean? She said that they were holding a conversation with her and her legs were crossed. I was like, wow, that was impressive. What, the proper way to do it. So I had to tell a CMA to make sure she did it again. And so we have to constantly educate ourselves. We don't want false positive, right? We don't want to be on medication if we don't need to be on medicine. So doing it adequately. And you mentioned something, Mr. Monet, about making sure that the cough that you're using, the kit that you're using is calibrated, because sometimes if it is not calibrated, you might be having either normal numbers or high numbers. So every now and then you can either do that at your pharmacy center or at your healthcare provider, but just make sure batteries are in, they're not expired, because you want the correct number.
Correct, absolutely. And so this slide here also empowered a lot of patients, as you mentioned, and we encourage some of the health centers to post this up in their triage room. So that's a reminder to them as well. So here it is. Here are step-by-steps in terms of how you check your blood pressure accurately. And I kind of covered that. And so in some cases, but allow you to rest for at least 5 minutes. Again, avoid that conversation, and have the patient take the first 2 readings with his or her own device. Like, for an example, if they're in the office, here are here's some other points. Take a 3rd reading. We recommend taking 3 to get an average, and again, rest 5 minutes in between. In some cases, take a 4th or a 5th one, but you want to at least take 3 to get an overall average as it relates to your baseline. And that having your baseline, that means your number, and then those readings afterwards, you just keep track of that. And how you can keep track of that is you can download this free app. This is a great blood pressure tracker that is available. You can download free on Apple, as well as the Android Play Store as well. So it's 30 BP. So I highly recommend that. And this app also will give you an aggregate number of your readings over 30 days, 60 days, or 90 days. So yeah, and here again are some other tips that we recommend, and you're familiar with this, Dr. Babs. I see you smiling. Life 7, you mentioned these.
Yeah.
If individuals just do these simple 7 simple steps: stop smoking, eat better, get active, lose weight, manage your blood pressure, control your cholesterol, and reduce your blood sugar. Just think about it. If you do one, it impacts all the rest of them.
Absolutely. Those are a magic 7. I mean, it covers one every day of the week, right? So I love that you have this here. So and we are creatures of habits, and things that we've done over and over. It might take some time, but the effort, the progress matters over perfection. Little baby steps. Now, back to my situation with my blood pressure, I had to find out what my issue was. And it was, I remember the doctor sat by my bedside and said, we've done CT scan of your head. We've done all the blood tests. They thought maybe it was eclampsia, which could happen a week after delivery, even though I didn't have blood pressure issues during pregnancy. And he sat by my bedside, and I can never forget. He said, Nothing. Everything is negative. No issues. But whatever is stressing you, you might need to unstress, because I was actually asking about my head CT if it was going to be covered by insurance. I mean, who asked that question? So that's how I was like a controlled freak. I wanted to control everything. So, you know, he said, whatever is stressing you, you have to de-stress. So what I did, part of the 7, was I did 2 main things. I walked every day, and, you know, I was on maternity leave, so I could do it, I guess. So I walked, I just walked, and I did 30 minutes walk. The recommendation for being active is 30 minutes, 5 days a week. Now, there is data that shows that you don't have to do the 30 minutes all at once. Just being active. Some of us have a sit-down job. Some of us, you know, when you get busy, you just sit down for long hours. It shows over time, there are studies that have shown and data that show that it's just as bad as smoking when you're just sedentary, where you don't get up at all. So my encouragement to you is, if you have a sit down job, at least every hour, set your alarm, get up, stretch, move around the block, you know, just try to get 30 minutes, 5 days a week. So I did that. I was on 3 blood pressure medicines, and I was so nervous trying to check it over and over. Is it better? Is it better? So that alone gave me additional stress. So I stopped checking it. I just did it, you know, at least once or twice, but I didn't want to overly get stressed, because 3 blood pressure medicine wasn't getting down. But it wasn't until I started walking, where I started doing other lifestyle habits changes, that I was finally able to get off the medicine. Of course, paying attention to my eating habits, which is another one. So, you know, the idea is, you mentioned about salt, right? The chips, the bag of chips, all of that absorbs water along. We don't know that, but anytime, I don't know, have you ever noticed that? I don't know if you like a bag of chips or not, but if you have to indulge with Super Bowl, what did you have for your snack for Super Bowl, Mr.? Did you have any like major? I know we try to stay away from the chips, but anytime I eat chips, I swell up a lot. So I pay attention, even though I'm not on the blood pressure medicine anymore. I know what my risks, I know what my triggers are. So making sure that the nutrition is more nutrient dense than calorie dense. And what I mean by that is cutting back on all those, you know, those processed meats and turkeys. They have tons of sodium. You want to drink more water. So just eliminate the things that are not good, but before you eliminate them, put the good ones, so that you don't feel like everything is just stripped out of you. Again, remember, the goal is to prevent, treat, and reverse high blood pressure. Part of the 7 goals, how often do you, for your movement, how often do you move, Mr. Mooney? What is your...
Very good question. You know, I have to be honest with you. You know, I'm a work in progress myself.
Great. We all are.
And so I try to you know, what I preach, you know, incorporate into my life. So I recently started, because I work from home, and I'm in my office all day. What I started doing was doing push-ups. I would start off with 25 push-ups and a day, and then of course I didn't start with 25. It may have been 5, but you know, I eventually got up to 25, and then I said once a day, and then I started doing it in between like meetings or something of that nature, or I might step outdoors and walk my dog for a few minutes or something of that sort. But I need to increase that part in my life to incorporate exercise. And it's so funny you ask that question, because I would like to also share with the audience is that, you know, if you are on blood pressure, as Dr. Bass mentioned, you can get off, you know, by doing the Life Simple 7. Give you an example. I had a project where one of the patients was a truck driver. He traveled, and so a lot, and so he could not prepare healthy meals, exercise, so he thought. And so we started getting that feedback from other patients. So we started bringing in how to properly prepare meal prepping and healthy meal prepping, you know, recommending healthy snacks on the road, prepare fruits and celery and just different healthy snacks that you can on the road. And then we also provided them with, you don't have to have a LA Fitness membership. You can have a
Yeah,
jump rope. We provided the patients with jump rope.
love it.
And what he did was that at each stop that he made, he would jump rope for 20 minutes.
Wow,
And
look at that.
and he was on the verge of losing his job because his blood
Mm,
pressure was not improving. And because of those two things, that jump rope for 20 minutes when he stopped, those meal prep, he has reduced his medication, he
that's
lost
amazing.
weight, and he's still employed. And
Oh,
there's several
yes, that's
stories where
great.
patients are on 3 to 5 medications, exercise, change the diet, and they are off all of their medications. So it is possible. It's not a life sentence.
Oh yeah.
I
Oh
will.
no. I'm so glad you said that. It's not a life sentence because a lot of times, and I do have patients that are hesitate. They say, and I was there too because I didn't want to be on meds, but I took the meds because I didn't want to die of a stroke either, right? I
Right,
didn't because
right,
I didn't want that whole as you had of the bunction and the power chain. Because over a long period of time, as we mentioned, anywhere there are vessels in the body is going to be affected. So the
right.
kidney, the eyes, all of that will be affected. And I took I took the meds, but the goal was to get off of it, changing my habits, reducing stress levels, finding stress relieving tips, and the walking helped me, changing my diet, finding out what were the things I was doing that was raising my blood pressure, definitely emphasizing sleep. Oh goodness, sleep is so important. And we don't do enough of that because we're all super busy, but really making sure that we take time to rest. And we need to, of course, sometimes we just have to sit down and rearrange our schedule and what is important and what is priority. Our health is our wealth. And as we're talking about it today, heart disease is the #1 killer. So we need to make the change now. We need to make the adjustment. If you're on medicine, it is possible to get off the medicine with those changes. But having said that, I don't want you also to rely on medicine because I do have patients where they just want to rely on the medicine and don't want to make any changes. Now, just note that medicine is not meant to be long term, or because after taking it for so long and then they have to keep increasing it to make that blood pressure come down, there's going to be side effects, there's going to be interactions with medication. So the primary goal is to get to the root cause of the problem, correct that way you're not needing more and more medications to get that heart to work as well as it should work, right? The heart, all it needs is the right environment. You give it the right environment, the self-care, the quitting smoking. And of course, smoking can be difficult. I had a patient today that just said, I quit smoking cold turkey. It was just like that, but alcohol was a mess and she's still struggling with alcohol. So seek help. She was seeking help. And so seek help again, because your health matters to you. And of course, I always say there are 3 things that must not be in the same building at the same time: high blood pressure, high cholesterol, and high sugar. So those 3 things, they're like enemies. When you have, which holiday do we have coming up again? Is it Easter? Like people
Houston.
have family in town. Those, you don't want those 3 cousins sitting next to each other at the Easter table. So have those numbers. I know we're focusing on heart and hypertension, but those other 2 also need to be monitored because they interact with each other. If you have high sugar in the bloodstream, it thickens up the blood, and so the nutrients and the oxygen can't flow as well. Same thing with cholesterol, it clogs up the arteries, so the blood cannot flow as well. So those are all the things that we definitely need to be very mindful of and pay closer attention to. Yeah, so I'm so glad that I have just a few questions that I know that I've had patients ask. And if there are any from our audience, we want to thank you for staying tuned and listening. If you have any questions, please go ahead and send them in. We're happy to respond. There's tons of work that Mr. Millie has already told you about the great work he's done. The Barber Star, I know there was a period where we were training men, especially men that don't want to go to the doctor most times as their wives dragging them. And so that was a great initiative that you did. And we did it also at Grady, where we had men that said, you know what, I don't want to go down the path that my family went. I want to educate people around me. I want to overcome this disease. And amazing work was done and lives were changed. So one question that came to mind that I've had a patient ask is, well, so how long do I have to keep taking the medication? I think we've already spoken to that question. Some people say, I don't want to be on meds because if I'm on it, they say I can never get off of it. Well, it appears like that, but that's not adequately so. Everybody's situation is different. So for you, you just need to know that once your heart is in the right environment, it will heal, it will mold back. But if you keep subjecting it to the wrong environment, that is where those medications are needed. And rightfully so, those medications have their place. But you can get off the medicine. I am off, it's been 13 years now, and I'm not on blood pressure medicine. I check my blood pressure medicine. I check my blood pressure when I go to the dentist or for my physical. And then every now and then I check it again, you know, keeping just the self monitoring that you refer to. So you don't have to be on it lifelong. You have the choice. You make the decision on whether you're going to be on it lifelong. Do you have any other questions that you've had your clients that you've worked with that have asked? Okay.
Yeah, you know, here's one that I got a lot is like there were patients, the doctors prescribed a month worth of medication for to lower their blood pressure, and a lot of patients thought that after they finished that 30 pill bottle that they were healed. They don't need to take it, so they will follow up with their doctors. And please tell them that is not the case. And the thing is that it's so important that you follow back up with your healthcare providers, because to see whether or not their medication is actually working or not, and to determine whether or not they need to prescribe you a different type of high blood pressure medication. You know, that's, can you respond to that?
You're absolutely right. Yes, I'm glad that you brought that up. Yes, please always follow back up with your primary care provider. Do not get off your meds by yourself. No, don't do that. I've had patients, unfortunately, had a stroke just doing that because they weren't checking. I've had patients say, just similar to what you said, where the prescription ran out rather, and then they didn't ask for refills. And that was because most times they were supposed to follow back up in the clinic to see if that medicine worked. And if it worked, then they will refill it, right? So always make sure that you follow back up. If you're having any side effects to a particular medication, let your provider know so that they can reevaluate and see what needs to be, you know, what needs to be adjusted. Maybe reduce the dose, maybe increase it, maybe switch it out for another.
Right.
But yes, do not stop on your own. Make sure you do this in collaboration with your provider. Of course, it's a shared decision making, but you don't want to do it on your own because you don't want to risk any of those complications that come from having heart disease. Yeah.
Right. And, you know, again, as I mentioned about my focus in Black men's health, and one question that I always get in a session of Black men is what it impacts the medication.
Yeah, that's right.
And can you address that?
Yeah.
You know, the impotence, you know, this medication is going to make me impotent, and you know, and we need
That's true. And that is a valid question, you know. So it's funny because when I'm with patients and they ask that question, and sometimes they feel embarrassed. I'm like, you shouldn't. It matters. It matters. You should ask. Please, if your doctor gives you prescription and they don't tell you what side effects to expect, ask. They need to let you know what to expect. You know, we have calcium blockers, some things like amlodipine, those causes ankle swelling. So you have to have those conversations. Now, beta blockers, which are things like metoprolol, propranolol, those rightfully so can cause erectile dysfunction. Right. Yes, that's correct. Now, how do we weigh this? You know, it's the benefit of taking it to prevent you from having a heart attack versus having an erectile dysfunction. You know, so those conversations need to be had because we can switch the medication if that is something. It's not everybody that has it, but it's been known to cause erectile dysfunction, right? And nobody wants to have that. So definitely having that conversation with your provider. It does happen, yes, but not everyone has that. And my takeaway is always, the sooner you get off the blood pressure medicines by doing those 7, right? Those great 7, control your sugar, control your cholesterol, control your blood pressure, be active, right? Eat well, monitor your weight, and the seventh one is stop smoking. I think I covered all of them. You can
Yep.
show that. Yes, very good.
Yep.
Awesome.
Yeah.
Yeah. So as the sooner, and now let me say something. The smoking on its own can also cause erectile dysfunction. All these things here, even having nothing to do with the blood pressure, can actually cause erectile dysfunction. Because what is erectile dysfunction? It's just lack of blood. Blood is not being supplied at the right time. And smoking, actually, with all the fumes that occurs, it can reduce the lumen. So anywhere where blood flow goes. So again, even with or without medication, we need to alcohol consumption. Yes, alcohol can also do it. So
Yep.
please, 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 please let us note that we not just medications have numerous side effects, and I'm sure you know this already, but if we pay attention to our lifestyle habits, we can prevent being on medicine, and even if we're on it, we can minimize how much of exposure we are on the medicine. So yeah, absolutely. That was a great question. Thanks for asking it.
Yes. Yes.
Yeah, there is a question that I've had patients ask, and I had to ask this question too 13 years ago, just right out of residency when I didn't know any better, because in medical school they don't teach us much about nutrition, and so that's why I went to get additional training in lifestyle medicine and obesity medicine. But at the time, I didn't have the knowledge. So when I had my blood pressure issues, I really went and searched for heart food. So heart health food. So there are foods that warm the heart, that the heart is happy, just the same way that there are foods that make the brain happy. So let me share some of them with you. Leafy greens, dark leafy greens. Now, it's different between spinach and kale versus lettuce, right? So the darker it is, the more nutritious it is, the more the antioxidants it has, because you're protecting your heart, right? The muscle, it's a muscle, it wants to work well. So it needs the food that will help it. So definitely leafy greens. People say, well, how am I going to get, how much leafy greens can you eat in a day, right? The recommendation is at least 3 servings. So 3 servings and 2 servings of fruit. So the way I take it in, I could have it in a salad, I could have it in a smoothie, and I can have it as a side dish. That covers my 3 serving. Now, am I always perfect? No, there are days where I don't meet it, but I try my best. Like today now, I've met 2 out of 3, and the day is still young, right? So maybe I'll get my 3rd one in. So definitely you want to pay attention to your leafy greens. What are other things? Berries, all the berries. Oh, I fall in love with berries now that I know it helps my heart and it helps my brain. So berries, blueberries, strawberries, raspberries, all of those. You can eat them as a snack. I'm a sweet tooth. I'm recovering from sweet tooth. So I've taken a love for berries because it helps my brain better and my heart than the donuts and the cupcakes that I've had a love for. Avocado is also, do you like avocado? Mr. Mooney, do you enjoy avocado at all? Not many people do. Do you?
I love it. I love it.
Yeah, nice. How do you, can you share some of your dishes with your avocado?
Sure. With my avocado, I normally use it in some of my kale salads that I make. I put it on fish. I have a little habit with spices, so I think the avocado kind of balanced that spice. I put avocado on toast.
Nice.
Bagels, with my eggs.
Nice.
So I love avocados. Guacamole,
Ooh, nice.
I love it. I love it. And it's interesting that, you had mentioned about, your blood sugar. At one point my glucose numbers were going up, and I knew what was contributing to that, because I have a sweet tooth with chocolate chip cookies, and I had to eliminate it.
So we're partners then. It looks like I'm not alone.
So to fulfill my sweet tooth, I started making parfaits, yogurt with berries and walnuts, and I just pretend like it was just a banana split, and it tastes just like a banana split.
I like it. I like it. And you said walnut. Walnut is on that list too,
Yes,
Walnut
protein.
is on the
Yeah,
list. And you know how walnut looks? There was a time when I couldn't stand walnuts. I'll eat almonds, but I couldn't stand walnuts because I felt,
yeah,
why is it shaped like a brain? But it's
right.
because it's good health food for the heart and for the brain. And fishy,
Absolutely.
yeah, fatty fish, omega fatty acids are also good. Beans, legumes.
Right.
Yeah,
Yes.
so those are all health food. So,
You know, one thing
go
I
ahead.
like to share, me and some of my friends, this is our second year doing it for the month of February. Our complete diet is seafood. And so we share recipes in terms of as it relates to seafood, and
Nice,
and I've been learning how to prepare it, my tuna steaks, my salmon, shrimp,
nice.
oysters. I know that's probably not good, but
Now you're making me hungry. Now you're making me hungry. But yeah, but it's about elevating our palates. We really need. There's so many things that I eat now that 10 years ago, I was like, what is that? But I'm enjoying it. And the more I cut back on the sweet, I'm actually tasting the nutrients, right? It's all about the nutrients. So the takeaway message today is let us together get healthier. Let us elevate our perspective, our palate. Where the mind goes, the rest of the body goes. We don't want to rely on medication. The average number of prescription bottles that I have with a patient, without exaggerating, is like 9 to 13. I mean, all of that, imagine the interactions, but our body has a tendency to naturally heal itself if we provide the right environment. So that's another question that I get asked is, definitely what kind of foods will help me. Now, we've talked about the foods that will help you. So that means in the reverse, you want to slowly, when you get full with those healthy foods and they keep you full because they have lots of fiber, then you wouldn't have time and energy for the other foods that just crash you, right? You get that boost of energy and then it crashes you back to the beginning, so it's a gradual thing, but making those changes, little changes, one step at a time, makes a big difference. Yeah, so those are the questions I have. I don't know if there was anything else you wanted to add before we begin to wrap up
No,
here.
I think we kind of covered everything. Only thing I would just like to say is just, this is Black History Month. And Frederick Douglass' famous quote is, "Knowledge is power, and the power, knowing your blood pressure numbers. That's knowledge, and that's power."
Yes, and
Back
taking it
to yeah,
even a step further. I like that you said that knowledge is power, but applied knowledge is even more
absolutely,
powerful.
absolutely.
Yes, yes.
Yeah.
Well, thank you so much, Mr. Maroney, for just co-hosting with me. This has been great, and really thank our listeners for joining us and just being empowered today about your health. Please share this. It's live on YouTube, on the WCG network. Share it, watch it again. If you have questions, please post it on Facebook. I'll circle around again and answer those questions, because our goal is to empower our community. We don't want those narrative of our community being stricken by high blood pressure, heart disease. They say every few seconds somebody's dying of heart disease, and it's totally preventable. We can prevent it. So I hope that this information has inspired you to implement actionable steps. We've mentioned quite a bit. So I hope that you know that you deserve to live at your healthiest, because you're here for a reason, and that's to impact lives. So if you have any last comments before I share my nuggets, there is a nice nugget by
Right.
Leila Ali. Go ahead.
Yes. No, I'm good. Thank you, and thank you
Okay.
all for listening. And please, um, shoot your questions to Dr. Babb so we can respond to them as well.
Okay, awesome. So the last quote is, if you knew you could change your lifestyle and diet and avoid heart disease and other things, you should do it. And this is by Leila Ali. So look forward to seeing you back for our next session. Until then, we wish you and your family a wonderful rest of the week and healthy hearts always. Take care and
Take
God
care.
bless.
God bless. Take care.